Today we're going to talk about why compliance isn't just a box you check off during a M&A transaction in life sciences. It's often the deciding factor on whether a deal goes through at all. We're going to touch on the DOJ's corporate compliance guidelines. We're going to talk specifically as they relate to M&A, for example. We're going to talk about some of our real-world experience dealing with this issue, and then dig into FDA and OIG expectations around due diligence, successor liability, and even individual liability. In pharma and biotech deals, as we all know, you're not just buying the IP. Everyone knows you're buying this IP. You're even buying the labs potentially, and even access to the people. However, you're also buying regulatory baggage. If compliance is sloppy, you may be inheriting unreported safety issues, off-label promotion risks, billing fraud, or clinical trial misconduct. Again, these aren't theoretical. They can lead to multi-million-dollar penalties, years of monitoring, and again, importantly, reputational damage. That's why private equity investors who traditionally worried about EBITDA margins and pipeline strength now think about compliance officers. If you don't, DOJ, FDA, and OIG can have and will do it for you. And you won't like their version of due diligence. The Department of Justice has been very clear. M&A transactions don't give you a get-out-of-jail-free card. Its corporate compliance program guidance put out in 2023 and updated in 2024, the DOJ specifically calls out mergers and acquisitions. The expectation is that buyers will do two things. They'll look at pre-acquisition due diligence and post-acquisition integration. Let's talk about pre-acquisition due diligence. Look under the hood. Understand the target's compliance culture. Look at their past violations. Look at their internal controls. Look at their risk exposure. What kind of audits were they doing? Were those audits good enough? What kind of CAPA program did they have? Post-acquisition, don't just sign the deal and walk away. The DOJ wants to see a real plan. They want you to integrate compliance and retrain staff and address past deficiencies. In fact, they actually come out and say that you might want compliance on the board during the M&A transaction itself. They want them to be part of table stakes. The DOJ even says that they will consider whether a buyer took compliance seriously when deciding enforcement. Let me translate that for you. Your liability, your risk profile, and even your penalties can be tied directly to how well you handle compliance in the deal.
Enjoying our content? We'd love to hear more. Please like, comment, share, and find more.
Let's apply this to the real world. Let me give you an example of a client we actually had. This client was looking to be acquired. The numbers were attractive and the pipeline was strong, but compliance reviews showed lack of controls. This means questionable marketing practices, concerning research processes, and more. In this case, the deal survived. But that's only because the buyer demanded an escrow. They adjusted the purchase price and imposed strict pre- and post-close compliance reforms. On the other hand, not everyone's that lucky. I've seen deals collapse outright because compliance red flags were too big. Think about improper clinical trial billing. Look at unreported adverse events, or look at suspected kickbacks. No matter how attractive the revenue, if the compliance risks overshadow the upside, the deal simply isn't worth it. So let's make sure that you're prepared. Now let's talk about the FDA and OIG. These agencies aren't just sitting on the sidelines. They expect acquirers to do their homework as well. The FDA is laser focused on truthful marketing, clinical trial integrity, and adverse event reporting. If you acquire a company that has cut corners, you inherit their problems. If they fail to report adverse events, you are now responsible. If they've been promoting off-label, those promotional materials are now yours. The Office of Inspector General cares deeply about billing and reimbursement compliance. This means clinical trial billing, Medicare/Medicaid fraud, or anti-kickback issues. Here's the kicker. OIG looks to successor liability. Just because misconduct occurred before you bought the company does not mean that you are off the hook. Let's talk about that successor liability. Successor liability is the idea that sins of the seller can follow the buyer. The government's eyes, changing ownership does not erase the underlying misconduct. If you buy a company with compliance violations, regulators can and will hold you responsible for cleaning them up, and sometimes paying for them. Then there's individual liability. Think about the Park Doctrine, the Yates Memo, and other subsequent DOJ pronouncements. Executives, board members, and even investors can be held accountable. This is especially if they knew or should have known about the misconduct. Private equity, this means that your role as an owner is not passive. If compliance lapses happen under your watch, you or your firm could be in the crosshairs. Follow our page on LinkedIn. So what are the key takeaways for private equity owners? Number one, compliance is a valuation issue. A shaky compliance program can and will reduce enterprise value. It may change deal structure or may actually kill the deal entirely. Due diligence must be specialized. Bring in people who understand the FDA and OIG nuances, not just financial auditors. Number three, expect successor liability. Build protections into your deal structure, whether we're talking about escrows, indemnities, reps and warranties, or integration timelines. Number four, post-close matters. Regulators judge you not just on what you found before signing, but how quickly and effectively you fixed after. And number five, protect yourself as individuals. Document your due diligence. Ask the tough questions. Make sure the compliance plan is real, not theoretical. For PE in life sciences, compliance is not a side note, it's the deal breaker. DOJ's corporate compliance guidelines make it clear you can't buy your way out of compliance problems, but you can buy yourself a way into them if you're not careful. If you take one thing away from this episode, let it be the following. Compliance due diligence is not a cost center, it's deal insurance. And the firms that treat it that way are the ones still standing after the FDA, DOJ, or OIG come knocking. Call, click, or email